What are we doing today? We're talking about optimal lifting and stretching and techniques to keep your back healthy, regardless of what situation you might be in. So why are we going to talk about that? About 80% of Americans are going to experience low back pain at some point in their life. That's a huge percentage. It's also a huge percentage of the reasons that people go to seek medical attention. So it's very unfortunate, but we know that an awful lot of folks know it's a pain in the neck to have a pain in the back. So we're going to talk about that a little bit. What does a healthy spine look like? Let's see what's back there. This is a model of the spine, and if you'll allow me to call this a person, this person is facing this way. This is the back of the head right here on the spine model, putting the hands on the hips, hands on the hips. This is a cervical lordosis, a normal curvature in the back of your neck. It sways this way. A normal kyphotic curve, which is pronounced if you're like this, and a normal lumbar lordosis, which is also pronounced if you have a sway back and you're going backward like that. But these are all normal curves. And just as a front view, that's what the front view looks like with hands on the hips. Excuse me. In addition to all of the vertebral bones that are here, there's discs that are in the middle of each of those bones. The discs are like little jelly donuts. So if you have the disc in between each one, that allows for some shock absorption. If by chance you have a herniated disc or a bulging disc, the bulge would look something like this, where it would just be coming out a little bit from the jelly. And since there's a blood supply, it's red. And if it's actually herniated, then it comes out, you can see more prominently. And if that herniation pushes on one of these nerves that come out from between each level of the vertebrae, that's when people get that referred pain or shooting pain or nerve pain, because the herniated disc is pushing on the nerve. So we're going to talk about ways to keep your back healthy to avoid that happening in the first place. What I will say, though, is they did do a study and a number of people, and they found that 30%, around 30% of people over the age of 25 have a herniated disc, and they don't even know it. So just because you have one doesn't mean that you're going to have back pain, which is why when you have back pain, it doesn't make sense to just automatically get an MRI, because it might show a herniated disc, but that may not be the reason for your pain. So that's something just to have in your back pocket. So we've talked about the curves. And why do we have the curves and why do we have the discs? Those help to absorb shock. As you're moving, say you jump down from the couch or you're rolling around, this allows you to flex a little bit, have more motion, have more ability to move and absorb the shock. If you didn't have that, if your spine wasn't segmental and didn't have all those jelly donuts for shock absorption, it would be more like a pipe just walking along. And you can imagine how little shock absorption that would have and how much wear and tear you'd get quickly on your bones if there weren't any shock absorption to help it out. So talking about this alignment, what is proper alignment? If you were to take a plumb line, which is a string just hanging straight down by gravity from the ceiling, you should have your ear line up over your shoulder, over your hip bone, just behind your kneecap, and right over your ankle bone. That's proper posture or proper alignment. Why is that important? Alignment really helps you to, if you have proper alignment, to limit the amount of wear and tear on your joints. So you can kind of think about it like a car. Good set of tires in good alignment lets you have good wear and tear on your car, so it minimizes the issues. Unfortunately, it's not as easy to replace a set of tires and get a new alignment for a car when you use it for your back. It's harder to get that realigned over time, but it can be done if you work on postural exercises. So why we mention all of that is you have to have good alignment in order to use good body mechanics and to lift correctly. To properly lift using those body mechanics, it speaks to how you carry, how you move, you push or you pull something, regardless of its weight. It's good, a good process if you keep your spine in a good position while you're doing any of that lifting, or even a little bit of what's called a posterior pelvic tilt when you go to lift something, because that aligns your spine well to absorb the weight. Much like a good car mechanic helps the car stay healthy. Good body mechanics help to keep your spine healthy. So a few general lifting principles. First, you want to size up the load that you need to lift. Is it something that's awkward? Should you have somebody help you? That's key because you want to figure that out beforehand. You want to make sure you start with it close to you, and you want to maintain a wide base of support with your legs apart, your feet under your hips. If you have your feet right close together, it's much easier to lose your balance and tip over and strain your back. If you have your feet planted, you're going to have a wider base where it's really kind of hard to knock you over. Think of football players. When they line up, they're spread with their feet apart with a nice wide base of support so that they're nice and sturdy. Remember also that you can push twice as much weight as you can pull. The leg muscles help you do the pushing, and they're made for heavy, strong, big, bulky movements. The back muscles, because there's so many little bones that are interconnected, it's a lot of little muscles, some big ones as well, but the back muscles are not made for that lifting, and they're therefore not made to do a tremendous amount of pulling because it strains in the back. So what you want to make sure is when you're lifting that you don't twist while you're lifting something big. You don't want to bend all the way. So I'm showing things you shouldn't do. You don't want to be bending over at your waist and lifting with your back. You don't want to carry things in a stooped posture. For example, a heavy laundry basket. If you feel like you have to kind of bounce it along your leg, that's not good. Make 2 trips, only bring half the laundry up. The things that you do want to keep in mind is to allow for clearance when you're going to be moving something from point A to point B. Make sure the floor in the middle isn't littered with dog toys, children's toys, the magazine that you forgot to put away that could be a slip waiting to happen. So clear the way. You want to carry most of the load of whatever you're carrying to the front of you. As you do, now it sounds kind of funny, but sometimes you'll see people carrying things on their side or on their shoulder, but you really want to try to keep it close to you and in front of you. You also want to make sure that you pivot with your feet, and in doing so, if you're going from point A to point B, to just shift something over. For example, a heavy pot full of mashed potatoes. You're here and you want to put it over here. Put 1 foot pointing the direction that you're going to be coming from, 1 foot pointing in the direction you're going to be going to. What you're going to do is just weight shift over, pick the item up, shift onto that other leg that's already pointing this way, and put the item down. And you can see my back is getting not much twist because it's all in my hips, as opposed to if I had both feet facing this way to start with, and I turned, that would be a tremendous amount of twisting in the back. And then in general, you just want to kind of keep yourself in good alignment. That's the last of the principles. So a few lifting examples. One of the ones that people have seen if they've ever watched anyone play golf is called the golf lift. This is particularly good if you're picking up something little, like a pen or something that you dropped on the floor. When you go to do a golf lift, what you do is you lean over and you extend your back leg at the same time. While you do that, you can see your spine is staying nice and straight, and you're not putting undue stress on your back when you come back up, because the weight of your leg is just your pivot point, and it doesn't make you arch. So that's a golf lift. Great for picking up a pencil, a piece of paper, a fork, or something like that, little. If you've got something heavier in the trunk of your car, maybe it's a case of water, a suitcase when we get to travel again, perhaps a hockey equipment bag. A great way to approach that, instead of pulling the item out of the trunk of your car, put 1 foot up on the bumper of the car so that you can hold the item and use the push of your leg against the bumper to bring the item closer to you. And as you do that, you're not using your back really at all. You're using more of your leg to come forward, almost like a row action, and then carefully bring it in front of you and then down. Of course, everyone's always heard of using your legs, not your back, when you lift. Specifically, if you're lifting something that's on the larger side, if you bring it close to you, or you get close to it, I should say, and you squat down with both knees, you bring the item in close to you and then lift it up. You don't want to be bringing it to you after it's already in the air. because that's going to strain the muscles unnecessarily. Pushing versus pulling, as I mentioned, you can push so much more. That comes into play a tremendous amount when you're moving furniture, such as when you're setting up Zoom to be from your home and you need to move the couch out of the way. One thing to also keep in mind is you can use those things that are very inexpensive and they help you move furniture, where they've got a plastic disc with foam on top, and those slide right on carpet very, very easily. And if you're sliding something that's heavy across a tile or a wooden floor, they have the fleece booties that go over them so that you just can push it right along, and it cuts down the resistance tremendously, makes it much easier. Lastly, if you're picking up something that's maybe a little bit more of an awkward shape or potentially moving, like a dog or a child, what you want to try to do is maybe go into a proposal mode, I call it. You go down on one knee. So you're down on one knee, you bring the item closer to you, and then as you step forward with the leg, you can use that propulsion to help you lift that item as you go all the way up to stand. I'm just doing a quick time check, so we're about halfway through, right on target. So some standing hints and sitting hints to keep your back nice and healthy. If you need to wear high heels for an extended period of time, it's really preferable that you limit the amount of time that you wear those as much as possible. So if you're going to be going to an event that you need to be dressed up for, maybe keep the high heels in the car, put them on when you get to the event, as opposed to wearing them all around the house while you're getting ready for the drive over, et cetera, et cetera. So try to limit how long you're wearing the high heels. You don't want to sit or stand in one position for too terribly long because the muscles get stiff, the joints get stiff. It's always good to get up and move around, lubricate your joints a little bit. Think of somebody who's been on the computer for maybe an hour putting a presentation together. The fingers are getting kind of sore. You take a step back from the computer and you stretch your fingers and say, wow, that feels so good to stretch it, right? Because it's been being worked for a bit. Now hold it there for half an hour at the end range of your joint. You can imagine that's going to get a little uncomfortable in the joints because you're holding them at that end range. That exact same thing happens to any joint that you hold at an end range or in the same position for too terribly long, especially when you're seated. People tend to end up starting the day in good intentions with good posture, and whether they're standing or they're sitting, that changes over time. So you'll see somebody in standing, they'll start maybe watching their soccer game, watching their kid play, it's great. Maybe 20 minutes into it, more often men will go like this and women will go like this. But by the end of the period of time standing, you'll see this kind of position to go into more of a sway back, much more of a lordosis, or this much, which puts you much more into a scoliosis. Interestingly enough, women have a high number of hip issues and hip replacements, and men have a higher number of cases of spondylolisthesis in the low back. Something to consider. So you want to make sure that you're really trying to move your position often. Along those lines, when you are seated for a while, you can put a ream of paper, or if you happen to have one of these handy dandy little footrests, you can put your one foot up on it, put both feet up on it, both feet down, and that gives you 4 positions to play around with when you're seated. And as you put one foot or both feet up, it actually puts you in a little bit of a pelvic tilt, which relaxes and stretches the low back muscles because it straightens out and stretches these muscles here. Let's see. We've talked about that. You don't want to stand for a long time with your knees locked. What you want to try to do is have them at a soft angle so they're not locked all the way back. And also when you're seated or standing for a long time, you want to make sure that you engage your core muscles. Do a pelvic tilt just to do a pelvic tilt. To tighten those muscles, you can add in squeezing the glute muscles together, and that's going to work on your core. Sometimes people picture a great way to strengthen the oblique muscles or the deeper muscles of the abdominal area is to try to, when you exhale, think of your trunk restricting or constricting in, so that you're trying to get your belly button as close to the backbone as possible. So you start out this way and really try to shrink it in as much as you can, and then you go back to regular and shrink it in as much as you can and go back to regular. That helps to tighten up your core musculature. As you're standing, we talked about putting one foot up or the other foot up. I'm sorry, in sitting, we talked about that. You can do that in stand as well. Also, if you're standing for a long time, it's great to have a padded mat. If anybody's ever shopped at one of those BJ wholesales or such, they have those gray foam mats that the people stand on. Those are fabulous if you need to stand for an extended period of time. They even have home versions that you can put in front of the sink if you're someone who prefers to wash the dishes or you do a lot of cooking. Having one of those adds just a layer of impact absorption if you're going to be standing for a long time. You want to keep your work at a comfortable height. If you like to stand when you're working, make sure that you're not leaning forward to get to your work. Put a ream of paper or a couple of books underneath it so that you can stand with a nice straight spine and still have a good ability to do your work. When you're looking at a monitor, you don't want to have it so that you're constantly gazing down. If you need to put a ream of paper or books under the monitor to raise you up so you're looking straight forward, or a slight downward gaze, that's better than having this. People that are like this for a lot of the day, I guarantee you a high percentage of you are going to have not only prolonged neck pain, but headaches and such as well. So in addition to keeping your work at a comfortable height, you want to make sure that you have a good supportive chair. Preferably, you want something that supports you right about to here. Once your back starts to curve this away, you don't really need a chair higher than here because your spine goes away from it anyway. And you don't want to just be having a chair that you lean back in to support you because that's not using your muscles anyway. Another great chair you can consider are the ones that come with the big therapy ball on them. It's really hard to slouch on those because if you slouch while you're sitting on one of those therapeutic balls, you kind of roll right off. So it's a great one to consider to alternate with. Not necessarily to use all day because you do want something that has arms on it and to switch out what you have for support, but it is a nice idea. When you're standing, you want to make sure you have your feet apart and you have your core engaged like we talked about. That's important, again, just to keep everything together so that you're not having a tremendous amount of pull one way or another. The reason that word core is so strongly stressed in any kind of an exercise program and anyone who has back pain that goes to physical therapy is if the muscles in the stomach are not toned, it's a tremendous drag on the lumbar area of the spine right in here. Because unfortunately, an extra 10 pounds of weight in your stomach, because of the mechanics and how this back is shaped, an extra 10 pounds of weight in your stomach is an extra 100 pounds of weight translated onto your low back discs. So the stronger you have your core muscles, the less that risk is going to be pushing and the better your back could potentially be feeling. So we've got some hints about child care and back pain as well. You might see when you go to the grocery store someone who picks their toddler up, they're having a great time, and they go whee and put them right into the carriage all in one fell swoop. If both feet are facing this way when they pick that child up, and they turn that away and get the child kind of there, or even worse, they plan to take a step while they've got this little person in their hand and potentially could lose their balance. Not a great idea. So trying to have that thought of 1 foot where you're going from, 1 foot where you're going to, combine it with the squat, pick the child up, have them help you, have them put their hands on your shoulders, pick them up, and let them get into their legs into the carriage. So you want to try to avoid all-in-one movements such as that, because that just puts you at risk for a couple of different things to get hooked up. This one looks funny, but it does work. When you have a toddler who's learning how to walk, or you want to kind of walk with them, instead of walking along with them like this and straining inside the whole time, what you can do is go into a little bit of a squat. You're going to be strengthening your quad muscles while you do this. You can hold the hands right here and walk along with them, and it strengthens your quads, but it also keeps your back completely in good alignment as long as you don't lean way over. When you're changing diapers, what you want to make sure is that you're not leaning forward for that as well. So whenever possible, you want to obviously use a changing table, but that's not always available. So if by chance you're in the car, instead of leaning over to the car seat or the back of the car or whatever, or on a couch, sit right next to the child, and you can sit astride them with just a little bit of a corner, not a full turn, and change them that way so that you're not leaning over while you're going through those motions. In general, with the kids, you don't want to bend over at your waist when you're lowering the child to the floor. You want to go down with your knees, as we talked about, and just lower yourself with them. The things that you do want to make sure you remember for child care and back health is you want to use a stroller, a sling, or a well-fitting backpack whenever you're able to, so that it, again, goes to those principles of keeping whatever you're carrying close to you and near your center of gravity. When you are giving them a bath, kneeling astride the tub or even inside the tub, so that you're not leaning over, because everyone who's ever done either a dog bath or a child's bath and leans over for it, you know how uncomfortable the back is after that. So trying to minimize that. When you're using a car seat, you want to make as much room as possible for you to maneuver. Put the seat that's in front, the front seat forward as best you can to give you enough room to maneuver while you're adjusting them into the car seat. And you also want to think of those cribs, if you have real little ones, the cribs with adjustable walls. Sometimes people kind of overlook that and they never use them. They're there for a really good reason. As you lower the wall of the crib, it lets you get that much closer to the child before you lift them. Also, when the child gets old enough, have them stand to help, because they can sometimes do a little bit more than we may give them credit for. Let's see. Time check 1:24. I'm going to just go over a quick summary and then check out the questions. So summary in general, you want to assess what you're about to move or lift before doing anything. You want to get help as necessary. You want to bring those objects close to you before you lift them. You want to lift with your legs, not your back. You want to shift your weight to and from the object as opposed to twisting. You want to keep your spine in good alignment, and you want to engage your core. So I'm going to check the chat now, but in the meantime, I thank you so much for joining us for today's webinar for healthy hints and how to keep your back healthy. Let's see what we've got. Any questions? Looks like we don't have any questions yet, so feel free to put some in. We got a few more minutes for that. As far as the programming that we have, please feel free to go back and check the site where you learned of this programming and join us for the other Wednesday programming for wellness, virtual wellness, as well as our mindfulness programs that are on Tuesdays and Fridays. And we've got a whole bunch of other great things that are listed there for you, free of charge, because Harvard Builder wants to take care of you during COVID-19 and beyond. So let's see, we have a question that popped up. Let's see. So, what are some good, simple exercises or stretches to strengthen the back? Great question. As you are either, let's see, I'll do some standing ones to start with. I talked about keeping yourself in good alignment for your spine. So actually doing pelvic tilts in any position, whether you're seated or standing or lying down, which is just flattening the small of your back. So if you put your hand in the small of your back area, and basically what you're trying to do is push into your hand. So if you were lying down with your knees bent up, you would be flattening into your hand. As you're standing, it kind of looks like you're just tucking your buttocks underneath you, and you're tightening your stomach muscle. That's a great one right there. Whether you have back pain or not, that's a terrific exercise for your spine. Abdominal exercises are also terrific. So the tightening ones that we talked about, to try to feel like your core is shrinking inward. getting the belly button toward the back of the spine, as well as just doing partial crunches. When you do partial crunches, lying flat on either the floor, or if getting up and down off the floor is a little difficult for you, go across the foot end of your bed if you've got like a double bed or bigger, because the foot end never gets as broken in as the rest of the bed does. So if you lie across it, you've got a firmer support system. So you lie on your back with your knees bent up, and while doing that, you can put your hands just cross them in front of you and do just a partial curl, just to clear your shoulder blades up, and keep breathing, because the biggest mistake people make is they forget to breathe. So while you're doing it, count out loud, 1, 2, 3, 4, 5, and then slowly back down. Take a breath in. As you're exhaling, count out loud. The reason I say count out loud is if you're counting out loud, you can't hold your breath, so you can't put that extra pressure on your cardiac system. And by counting out loud, I do mean counting. I don't mean 1, 2, 3, because you want to make sure you're really getting that air out. Stretches for your hamstring is probably one of the most commonly needed exercises that are related to people with back pain. And the way that you can do that in stand, I'm just going to turn this down just a little bit. If you're standing, I know you can't see my head, but you can see my foot. If you put your foot up on a surface and you keep yourself nice and straight, what you're going to do is hinge at the hip. You're not going to bend at the waist. You're simply going to hinge at the hip. You'll begin to feel a stretch down the back side of your leg, which is your hamstring. And if you really want to add into it, after you get a really good stretch, keeping that back straight, bending only at the hip. Once you get to the point where you can't take any more of a stretch in the back of your leg, slowly bring your toes towards you. That'll extend the stretch into your calf musculature. That would be, if people would only do 2 exercises for the back, I'd say the pelvic tilts and the hamstring stretches, and the next one up obviously would be the crunches to strengthen the stomach even more so. Yoga, fantastic at whatever level you're able to tolerate. There's tons and tons of different back exercises out there. Perhaps the most common one is if you're on all fours and you lift one arm in the opposite leg, and then you lift the other arm in the other leg. What that does is work the upper muscles on one side with the lower muscles on the other side, and it lets those work in conjunction with each other. Just like when you're walking, you want to have the upper side of one side of the back working with the lower muscles on the other side of the back, and that's what keeps you in balance. So those are some key and relatively easy exercises to do. Let's see if there's any other questions. I think that is all we've got for questions right now. So we're at 1:30. I will be on for just a couple of minutes if somebody else wants to put in a question. But this brings to a close our presentation on hints for a healthy back. We hope you have a fabulous day and that you're able to join us for another one of our Harvard Pilgrim virtual classes. Take care. Bye-bye.